right,
Sure
here
was
we
nice
go.
to meet you.
We'll see you in a bit, okay, Tati? Ciao, Milenka.
All right. You ready?
Look, they put the sirens on. Hey, Januszka, come back here. Get back here, buddy. Ian, you going home, buddy?
Yeah.
Puffish.
Like a puffer fish, yeah.
Did you ever have that done at the doctor's? The doctor do that to you before?
Yeah.
Yeah.
It was so tickly but puffy.
But this one's really picky. So when I put it on, you can't move your arm, okay? Because otherwise it won't work. Is that okay?
You can stand still.
Yeah, it won't. It works, but
What's piffy?
No, picky.
picky.
What's
Picky means it's if you move your arm, then it doesn't work right. It's broken. It'll get broken. So try not to move. Here it goes. Don't move it. I'll let you know when you can move it, okay? It's almost done.
You're doing good, Tati.
so tight?
Oh, wait. It's almost
It's
done.
almost done. Oh, there you go. All done. You can take it off. There you go.
Oh, so tight.
Good job, Tati.
Did it squeeze too hard?
Yeah.
You're breathing pretty good.
100.
100, yeah. That's pretty.
I can count all the way to 100 by myself.
Violetta.
Yeah.
Violetta, I spoke with her. Hi, Violetta. It's Dr. Ott. We spoke yesterday. Hi, Milena. How are you?
Yes.
Who do you have here with you? Is this Dad?
Milena.
Is it okay if I chat with Dad? You can hang out with your bear in there, okay?
She was hoping for a girl dog.
Yeah. Oh, gotcha.
You're okay, Tati. It's fine.
I hear. Do you any history of problems with anesthesia for her in the past? Any family history of problems with anesthesia? Any history of lung disease or
No,
kidney disease for her?
not for her, no.
Any history of heart disease for her?
No.
I know just that little murmur that they heard at their last visit, but she's otherwise active, healthy,
Yeah.
running around.
Yeah.
Doesn't seem to get short of breath or have chest pain when she's running around.
No, lately she's been kind of, I think it might be a seasonal allergy
Sure,
thing.
just clear her
It's
throat
like
a little bit.
trying to clear the throat all the time.
She never has times where she has to like squat down when she's running around
No.
to kind of catch her breath. Okay.
No.
Okay. Any history of diabetes for her?
No.
Any history of stroke or seizure in the past?
Nothing like that, no.
Any problems with reflux or heartburn for her that you are aware of?
No, sometimes constipation, but I think
Sure.
girls her age, that's kind of
Sure.
normal.
Yeah.
She forgets to drink water a lot of times, so
Yeah.
maybe it's kind of more on the dehydration side.
Okay. Sure. Lena, do you have any loose teeth that you know about? You got any teeth wiggling around in there?
Any pirate wooden teeth?
No loose teeth that you're aware of? No. Okay.
No, we're actually kind of shocked that they found, because this is in the bag.
Yeah.
And she does a pretty good job at brushing for what we
Yeah.
thought, but apparently she doesn't. She needs to start flossing, I guess, too. So.
Gotcha. Okay.
I flossed once.
You flossed
Yeah.
one time, but I
It's
guess.
important. It's important. Trust me. I used to not floss enough, and I ended up doing this a lot more than I should have when I was a kid. So I think you'll be good. I'm sure. So plan for today, a little bit before we go back, we'll give her some medicine to drink. Some of it's Tylenol just to help with some of the discomfort afterwards, and some of it's a medicine to help her relax a little bit, not remember going back to the OR or everything like that. And then when we're all ready for, she'll come back, we'll give her medicine through a mask to breathe in. She'll go to sleep pretty quickly with that, okay?
Yeah,
Once
she's only 30-some pounds, so
she'll go to sleep quick.
quick.
It'll just be a minute or two. And then once she's asleep, we'll put an IV in, okay?
Okay.
Once that
Yeah,
IV.
because she hasn't had any water or anything. to eat,
Yeah.
So yeah. Okay.
Yep. Once the IV's in, we'll give her some extra medicine there to go really deeply asleep. And then we'll put a breathing tube in for her. The breathing tube will go in through her nose. We'll just keep her sleepy and comfortable while they're doing their work.
Okay.
At the end of the case, we'll plan on letting her wake up and taking that breathing tube out and taking her to the recovery room. Okay?
Should I worry about her chewing on her lips or tongue, or it's not like the local anesthesia when
No,
she's...
they may put a little, if they have to pull a tooth, sometimes they put a little bit of local in, but it's not quite like that, no.
So,
She'd wake up afterwards, she may be, it's not uncommon for kids to wake up a little bit irritable, crying a little
Right.
bit, just kind of disoriented, but
For
it
a
shouldn't be any
5-year-old,
issues. Her mouth won't be numb or anything
Okay,
like that, unless they decide to put numbing medicine in for
and
something.
then as far as being able to eat and swallow after that, how soon did...
As far as I'm concerned, as soon as she's awake enough
Okay.
that she can swallow well, it's totally fine by me.
Okay, so
Yep.
nothing to worry about as far as choking.
Yeah, nope, she'll wake up pretty quick
Do
afterwards.
you have a question, Milena? Then they wanna make sure that's why we're here, so they don't take any teeth out.
That's right. They're gonna
That's
take
why
a
we're
look
here,
at
so you have a
them and get
beautiful
them nice
smile.
and
We're
clean.
gonna
And
clean them out and you're gonna have a beautiful smile, okay? They'll work with it, they'll tell you.
Yeah.
When you wake up, they're gonna show it to you, okay?
other than that, risk-wise, always a small chance of her having some kind of an upset stomach afterwards.
Okay.
We'll give her some medicine and try and help prevent
Okay.
that. She'll probably have a little bit of a sore throat from where that breathing tube is.
Okay.
Anytime we put a breathing tube in, there's a small chance we could cut or bruise a lip or chip a tooth. We're really careful when we do it. It's just
Okay.
possible anytime. Because that tube goes through the nose, there's always a small chance that she could have a little bit of a bloody nose afterwards. Okay. Beyond that, we'll watch her closely for how she's breathing, how her blood pressure is, how her heart's beating. I don't expect any big issues for her with those things, but that's why we're watching her close.
Yes.
That little heart murmur they heard.
That's actually the first time I hear about that.
Yeah,
Because,
I wouldn't anticipate it being any issue for her. We'll obviously keep a close eye on her. But given that she's so active, running around doing well, my
Right,
guess is
because,
it's just something they'll
her
follow along.
doctor has never mentioned anything about that, and every physical we've had has been alright. So that's
Yeah,
interesting.
I think it's just when you're coming for anesthesia, they just have to ask us a little more about it to
Okay.
make sure we didn't think that she needed to go see someone else beforehand.
Okay.
But given again that she's active, running around, doesn't
Yes.
have problems with that, I think that she'll do well
All right.
with the anesthesia. Okay, it just means I'll keep an extra close eye on her.
Will do.
Okay. Right. Can I listen to your bear?
Give him the bear.
You think I can listen to the bear? Okay. Does your bear have a name yet? Not yet. Okay.
You can call him Molar.
Oh, very good.
That's who they'll be working on.
Your bear sounds good. Do you think? Can I listen to you too? Do you think you sound the same? Right. Sounds pretty good in there. Are you going to bring your bear back to see me a little later? Maybe. Okay. All right. Do you have any other questions at all? Okay. All right. Well, we'll see you a little later, okay?
Alright, thank you.
All right. Thank you very much. Bye.
Milena, how you feeling? Huh?
It's not making me sleepy.
It's not making you sleepy?
yet? Some people, it makes them sleepy. Some people, it makes them kind of silly. Sometimes it makes people a little more active. Some people, but not most. It takes a little while for it to work. You'll notice probably within the next 10 minutes.
Nothing. She's not allergic to anything.
No.
Okay. Nothing to eat or drink at all today.
No, not since yesterday. 9 p.m. was her last drink of water, I guess. So
Okay.
hopefully the idea will get something to keep her.
Yes. Yep. She will definitely get some of that. All right. So I know you talked to Dr. Otten, the anesthesiologist, and Dr. Desjardins. Any other questions at all? All right. We think we'll head on back to the OR then. Do you have any other questions?
Mila? How are you feeling?
Silly.
You feel alright? You
She
gonna
does
be
have her
okay?
necklace on too, is that okay?
I see. Yeah.
Should we take it off?
If you want to take it off, you can. I mean, it shouldn't on our end. It shouldn't be
Okay.
in the way. Are you ready to go? All right. So we'll have you going down to Atrium, and that's where you'll wait. And then I'll call for you to come back up here, and Dr. Dan will meet you right out here to discuss what he did.
Okay.
Okay?
Well, thank you. I'll see you later, okay?
All right,
Sure
here
was
we
nice to
go.
meet you.
We'll see you in a bit, okay, Tati? Ciao, Milenka.
All right. You ready?
Kids, smile. He was having such a relaxing time, guys.